Hello everyone, welcome to the Heroes Initiative powered by IPCA. These heroes are instrumental in improving quality of life of the patients. Today we have one such hero who has improved life of tens and thousands of such patients. Doctor, we welcome you to the Heroes Initiative by IPCA. Doctor, now we are on retinal diseases, do's and don'ts. Doctor, my first question for you is, what are the common symptoms of retinal diseases and when should I seek medical attention?
The two most important symptoms that any signs that a patient can have is floaters. That means the person may say, oh, I'm seeing a lot of mosquitoes in front of my eye. Or if a certain person feels that I'm having flashes from the side of my eye, I feel like somebody's putting a torch on and off. These two are the most important things that you can do. These two things mean that there is a traction or there is something happening inside the eye which may be normal, which may be abnormal, and that definitely needs a checkup. Because this, if it is something is happening inside the eye, then it is predisposing to retinal detachment and which can cause loss of vision.
What kind of lifestyle changes or habits should I adopt to protect my retinal health and prevent diseases?
Wow, that's a huge spectrum. So if you are a myopic, so if you have that myopia means you have a minus power. Minus power patients, I routinely do tell them not to do any heavy exercises. Anybody who's above -6, -7, a regular 4-monthly or 5-monthly retina checkup. If they have any weak areas, then I might even ask them to get them treated or lasered so that we minimize the risk of ever developing any retinal detachment. I always tell all my myopic patients that these two signs of flashes and floaters, they have to be constantly aware of them so that they don't make a mistake. Now, secondly, if you're a diabetic, diabetic patients are prone to have retinopathy because diabetes affects the kidneys, it affects the heart, it affects the nerves, it affects everywhere. Now, by the time a person comes to know he's a diabetic, he or she might have had some damage. So, diabetic patient initial examination, retinal checkup is a must. If the doctor says, oh, you know what, you have nothing inside the eye, you can follow the patient as and how you want to. But if there is something inside the eye and you want it to be treated, that's very important. Now, thirdly, hypertensive patients. Hypertensive patients are prone to retinal venous occlusions and they do need a regular checkup and treatment in the form of injections, and that has to be taken care of. But I think there's a huge spectrum of retinal diseases, and lifestyle changes maybe has to be that for diabetics has to be just control their blood sugars, and for hypertensive to control their blood pressure, and for myopics have to be very careful that they're not excessively doing some heavy exercises that causes retinal detachment.
Are there any specific activities or environmental factors that I should avoid to reduce the risk of retinal diseases?
One of the most important thing for retinal diseases, as I said, lifestyle modifications, good diet, good health, and avoid smoking, because smoking causes not only ARMD but it also causes central serous retinopathy. And again, for myopics, no heavy exercises. Diabetics, control your blood sugar levels. So basically a healthy diet fueled with a low stress environment, which is not so common nowadays in a modern era. So that actually does help prevent retinal diseases. Yeah.
So doctor, your expertise and insights on retinal diseases, do's and don'ts are invaluable to this initiative. And we believe your participation will greatly benefit the patients.